Welcome to the Deep Dive by Global Heroes, your go-to for the real stories behind real heroes. Get more inspiring content in your inbox with our newsletter, and be sure to follow along on social media.
Okay, so let's just jump right in. We're doing a deep dive today on an organization called A Safe Haven for Newborns.
Right.
And their model for preventing infant abandonment is, well, it's pretty remarkable. This all goes back 24 years. The founder, Nick Silverio, started it after seeing just too many stories of babies being left in unsafe places.
Yeah, and that's the key thing to understand. Their approach isn't just about rescue, it's not reactive.
It's proactive.
It's completely proactive. They're focused on eliminating abandonment through education, prevention, and direct support. Their core promise is what makes it all work. Help is absolute, it's at no cost, and there's zero judgment.
And the privacy, the anonymity, that's paramount.
It has to be. They get that fear and shame are the biggest hurdles.
And you know, when you look at who this affects, the data shows it's not just one type of person.
No, not at all. It cuts across every age, ethnicity, socioeconomic background.
It really seems to be driven by a sheer feeling of helplessness, of having no resources and no one to turn to.
That's the crisis point, that feeling of complete isolation. There's a clinical psychologist, Dr. Andrea Korn, who explained it perfectly. She said that for a mother in that crisis, placing her baby in the right arms gives her the comfort she so desperately needs. She knows her baby will be safe, and just as important, she knows that she will be safe and anonymous.
Okay, so if that's the psychological need, safety, and comfort, how does their main procedure, the direct surrender method, actually deliver that? Because it's a face-to-face handoff, not some kind of anonymous Dropbox.
Exactly. And that's the strategic brilliance of it, that immediate human interaction. An infant is placed directly into the arms of a trained, compassionate health professional at a designated safe haven location.
Right.
And that achieves two critical things at once. First, the mother gets that instant, non-judgmental reassurance she was promised. It's real.
And the second thing?
Second, the professional can immediately assess both the mother and the newborn, and they can gather that vital health history for the baby's care.
But a model like that, it must require a massive amount of trust and just sheer scale.
Oh, absolutely.
You can't have a mother go to a fire station only for the staff to have no idea what she's talking about.
And that's where their infrastructure is so impressive. The foundation provides free, standardized online training.
Free for the professional.
Completely free. Over 25,000 have taken it. They also supply the official signage to every ER hospital, every 2047-man fire and EMS station. They bear all the costs to make sure the system is seamless.
So behind those physical safe havens, there's a whole human support network.
Yes, there's a multilingual confidential helpline. It gets over 2,000 calls a year.
Wow.
And the founder, Nick Silverio, always emphasizes that those calls are about active listening, really collaborating to figure out what that mother needs.
So what about the results? Does it work?
The impact is just.
Yeah.
It's undeniable. To date, 432 infants have been given a forever home.
432.
All right, 422 here in Florida, 9 in other states, and 1 even in Honduras. And beyond the babies, they've directly helped over 6,000 women.
With that kind of success, it makes sense that they're seen as the national model program.
It does. They've helped other states build similar programs, and were even instrumental in helping Panama pass its own safe haven law.
So they're exporting this life-saving system internationally.
They are. And what's so important for you, the listener, to know is that since they provide all this at no cost,
It's funded how?
the entire operation depends on the kindness of corporations, supporters, and individual donors.
Okay. So here's the thought we want to leave you with.
Yeah, think about this for a second. The whole system is built to protect a mother's anonymity, so they don't publicize the surrenders.
Right. It has to be discreet.
Exactly. So given that, what critical role does free, non-judgmental education play in making sure a program that must be discreet is still universally known in a moment of crisis?
That's a powerful question, that knowledge network. It's literally the key to life. If you need help or more information, the national helpline is 1-844-767-2229. The Florida line is 1-877-767-2229. And you can find them online at asafehavenfornewborns.com.
That's it for today's deep dive. Want more? Stay connected with Global Heroes through our newsletter and socials.